So hello, we are here with Jamieka Harris at Bobby Scott and Associates Professional Counseling in South Haven. How are you today, Jamieka?
I'm doing well.
Wonderful. So today I wanted to ask you about some things that you're seeing in regards to depression, particularly as it relates to the pandemic. Have you seen an increase in people reporting depression symptoms?
Yes, ma'am. I have a lot of clients that come in and they are telling me their symptoms, and they're not quite sure if they're depressed or not, but they think they may be depressed. And so we have a conversation where they identify their different symptoms, and we talk about how the symptoms are impacting them as far as their everyday life, at work, with their family, with their friends, and that's how I'm better able to assess whether it's depression or not.
Okay. And so when it is depression, what types of things are you able to do to help them with that?
So after my assessment, I kind of look at what's the source of the depression, kind of where it stems from. And so basically, if it's a relationship problem, we kind of work through the relationship challenges. If it's depression that's centered from a previous trauma, we work from that trauma incident, and we work and process through that. So it really comes down to the source of the depression. I do different things with my clients, like emotion profile. I ask questions about what makes them sad, what makes them feel guilty, what makes them feel shame, and I'm able to gather a lot of information that I can then use to help them work through the source of that depression.
Okay, very good. And so what about the utilization of medication? How do you generally recommend people begin a medication?
So initially when they come in, we have a conversation and I get an understanding of the severity of their symptoms. And if it's on the extreme end or severe end where the suicidal thoughts are constant, or where they're having self-harm, then I immediately recommend consultation with one of our psychiatric nurse practitioners. But if it's more manageable, and if they start to see a decrease in their symptoms of depression, I don't necessarily refer them out for medication.
Okay, that's very good to know. And how long generally does it take before people start to see a decrease in their symptoms?
So the way I explain it is when you come in for therapy, within, let's say, 4 to 5 sessions, you should start to notice that you're having a decrease in your symptoms, and you should start to feel better. And so if you're not feeling better, then that's when we kind of sit back down and we have a conversation, and that may involve me changing my therapeutic method, or it may involve coming on board with taking medications. But we have a conversation because around the 4th to 5th session, you should start to feel better.
Gotcha. And I'm sure that consistency plays a key role in, as far as people being consistent in coming to their sessions. That plays a key role in symptom reduction.
Yes, ma'am. I encourage my clients to keep their appointments and to follow up. And I give homework assignments as well. Homework is a big part of the therapeutic process. So there's a small part of the work that happens in the office, but there's a much bigger part of this that happens outside of this office. So I do give homework, and I do ask that they complete it, or at least we're able to process and break down and work through the different assignments. But that is a big part of recovery and feeling better.
Okay, good to know. Anything else you want to add?
Not at this time.
Okay. Well, thank you, Jamieka. I appreciate your information about depression, and I'm sure others will as well.
Thank you.